Starting October 1st, Medicare plans and agents will be anxious to sell you a Medicare Advantage plan. But should you switch? The decision to switch from a Medicare supplement to a Medicare Advantage plan is one that requires careful consideration and should only be made after understanding the pros and cons of each plan. We are happy to help you review and compare Medicare supplement with Medicare Advantage plans. Here are a few of the advantages of a Medicare Advantage plan. Medicare Advantage plans, also known as Part C. Medicare Advantage plans are offered by private insurance companies with a contract with Medicare, and they combine coverage for Part A, hospital insurance, Part B, medical insurance, and usually Part D, drug coverage. Medicare Advantage plans are typically HMO or PPO plans with a network of providers. Here are some of the main advantages of Medicare Advantage plans. Lower plan premiums, in many cases a zero plan premium. This is possible because Medicare pays the private insurance company to manage your benefits in lieu of Medicare. Premiums do not go up based on your age. Medicare Advantage plans put an annual cap, maximum out-of-pocket, on your medical costs. This amount is usually between $2,500 and $7,500 for a calendar year. Prescription drug coverage is usually bundled together with your medical benefits on a Medicare Advantage plan. Medicare Advantage plans often include benefits not provided by original Medicare, like dental, eyewear, hearing, and other benefits. With Medicare Advantage plans, you must still pay your Part B of Medicare premium. The standard premium in 2024 is $174.70. We don't have the 2025 Part B premium yet. Medicare Advantage plans often have ancillary benefits like dental and vision. However, many times these ancillary benefits require you to use small provider networks, and the benefits are of minimal value. It does vary by plan, but it's essential to compare the details of the ancillary benefits with Medicare Advantage plans. Disadvantages of a Medicare Advantage plan. Plan benefits and provider networks can change every year. Provider networks of doctors and hospitals can drop out of the provider network mid-year. Once you're enrolled in a Medicare Advantage plan, you may not be able to return to a Medicare supplement plan without having to answer health questions and be approved. While some exceptions apply, it is essential to understand that your ability to get a Medicare supplement plan in the future may not be guaranteed. Copays, deductibles, and coinsurance are significantly higher with Medicare Advantage than on a Medicare supplement plan like the Plan F, Plan G, and Plan N. Part B drugs like infusions or chemotherapy often have a 20% coinsurance with Advantage plans, which can result in you incurring large out-of-pocket costs up to your plan's out-of-pocket maximum. You must use network providers for the lowest cost. HMO-style Medicare Advantage plans, you must have a primary care doctor and obtain referrals for specialty care. There is no coverage outside of the network except in an emergency. PPO-style plans don't require a referral to a specialist unless it's part of that office's policy, but much higher costs are incurred at out-of-network providers. And out-of-network providers are not obligated to accept the terms of your Medicare Advantage PPO plan. Prior authorizations. This is one of the most often cited complaints about Medicare Advantage plans. Medicare Advantage plans require prior authorization for many services. These prior authorizations can lead to delays in care and sometimes denials of care. You may already be familiar with some of the advantages and disadvantages of Medicare supplement plans, but here's a quick recap. With Medicare supplement plans, you have the ability to see any provider anywhere in the U.S. who accepts Medicare and agrees to see you. Over 90% of non-pediatric doctors accept Medicare. There are no referrals to specialists required by the Medicare supplement insurance company. Some specialists may require you to have a referral as part of their office policy, but it's not required by the plan. The supplement carrier does not require prior authorizations for care. Medicare determines if your recommended care is covered. You have very low out-of-pocket costs for Medicare-covered medical services, particularly on plans like Plan F, Plan G, or Plan N. Medical benefits don't change year to year. The Part B deductible can change a little bit each year, but the core medical benefits on the supplement don't change. Guaranteed renewable. You cannot be canceled on your Medicare supplement as long as you pay your premium. Here are some of the disadvantages of Medicare supplement plans. The plan premiums are higher than most Medicare Advantage plans. Premiums go up as you get older. You need to buy a standalone Part D prescription drug plan, but you do get the choice of all the available plans, which can sometimes be a benefit. There is no or minimal built-in ancillary benefits with a Medicare supplement plan.